In recent weeks, we've seen a surge in your tips about COVID-19 outbreaks and conditions inside Central Texas jails. Since the start of the pandemic, thousands of people in those facilities have been released back into the community when they complete their confinement or bond out. Despite jails becoming hotspots for COVID-19 outbreaks, investigator Kelly Wiley found one Central Texas jail delayed offering vaccines for months, and some agencies don't plan to offer the life-saving dose at all.
We did have some normalcy in our lives, but not for very long.
For 15 years, Melinda Long says she's dealt with her son's mental illness and drug addiction. She spent most of that time fearing drug use would kill him. Her only relief over the years was during his repeated stints in jail and rehab.
We knew that he wasn't getting the meth, and he wasn't getting the drugs, and he wasn't hurting anyone.
But when he was booked in November 2020, what she feared was spreading inside the walls of the Williamson County Jail.
Fear that he's not going to make it out, and fear for the other families.
Since the start of the pandemic, the Williamson County Jail has reported at least 2 outbreaks of COVID-19, not unlike other jails in Central Texas. One outbreak is ongoing. But the outbreaks don't just impact the jail population. Since the start of the pandemic, more than 9,000 people have been booked in the Williamson County Jail, and more than 9,000 have been released. Many of them released before vaccines were available in the Williamson County Jail. Despite the earlier outbreak, the jail administration in Williamson waited nearly 7 months after the vaccines were made public in Texas to offer inmates the COVID-19 vaccine.
A lot of it was, the health district, we wanted to have the Johnson & Johnson because it's a 1 dose. And the Johnson & Johnson was harder to get. It was harder to get than the Moderna because it's such a transient population. If we're going to vaccinate, let's give them the full vaccination.
As you've seen how COVID has kind of worked through the jail outbreaks that you've had, do you wish that you would have started earlier in vaccinating?
I really haven't given that much thought. We talked about that, but no, we had it out of the jail. The jail we were from February until we had this uptick. We had no COVID. So it wasn't an issue.
Nearly 2 months after vaccines became public, Travis County Jail started offering the vaccine in February. Hays County Jail began offering the vaccine in March, and Burnett County started in April. But 2 local county jails say they do not plan to offer them at all, Blanco and Llano County. When we asked the sheriff of Llano County about his decision, he said our county jail does not administer the COVID vaccine. We've been fortunate in that we have not had a single case of COVID. Melinda's son got the vaccine just before he was released from Williamson County in early August. She believes the delay could have put her son's life at risk.
They don't deserve to die. That has been the thing I have prayed would not happen. I don't think that I could have handled it, and I know his boys could not have handled it.
And for much of the pandemic, the Texas Commission on Jail Standards was requiring jails across Texas to report their number of COVID cases daily. But the agency stopped requiring jails to do that back in June.
Beyond vaccines, what else are jails doing to keep COVID out?
Well, it really depends on the county, but they're largely using testing. In Travis County, all newly booked people into the jail, they're held in single occupancy cells for about 10 to 14 days. And the jail says really this is an extra layer of protection for them. In Williamson County, though, their policy is to offer a test. They say a lot of times it gets refused, and healthy people, they can go into general population. People who are presenting symptoms, they have to be quarantined.
All right. Kelly, thank you very much.
Thank you.
They were hit hard in the first wave of the pandemic. Now the family of a woman inside an assisted living center says she's nervous about what might happen if her sister gets COVID a second time. The concerns many families share after being forced to spend months without seeing their loved ones.